Great. Okay. Well, then I would assume it would be time to start. We're at 2:30. So what I will do is I will gladly give over the helm to Shane. So Shane, if you could please start, that would be great.
Oops. Sorry about that, Gordon. Welcome, everyone. Sorry about that. To our workshop today, being an LGBT plus older adult, needs, challenges, and resources. Sorry, got that. Gordon, can you take this title slide?
Can I take it off?
Yeah, can you just go through the title slide? Sorry.
Sure, absolutely. Sorry about that, folks. Hi, my name is Gordon Sauer, and I'm with SAGE, and today's program is being an LGBT plus older adult, needs, challenges, and resources. And we have 5 speakers, and they are Shane Lacey, who is going to be with us in a moment from Open and Out, and also the Open and Out Employee Resource Group. We have me, I'm from SAGE, and SAGE, by the way, stands for Seniors and Advocacy for GLBT Elders. We have Drew Warner from SAGE, an Open and Out Employee Resource Group. We have Jackie Barris from the Robert Wood Johnson University Hospital Proud Gender Center. And we have Vanessa Nazario from the Robert Wood Johnson University Hospital Diversity and Inclusion. Okay? So, Shane, are you back?
Yes, I'm back. Sorry, I swallowed wrong when I took a drink of water.
Good.
So everyone, like for us today, why this workshop? We know with the aging LGBT population, it's problems associated with the subpopulation are just not widely known to the general public. When we think about a lot of our advocacy work, you know, we think about a lot of work that's been done with LGBT youth, young adults, and HIV prevention and awareness. A lot of us, sometimes we just don't think of the subpopulation of senior LGBTs as an area for focus. So from the 3 sectors, not-for-profit groups are making a lot of headways by identifying and acting on these issues with aging LGBT population. Healthcare systems, they have programs available, but they're not adequate to address these specific or growing needs for the senior LGBT. And industry, you know, me coming from Johnson & Johnson, a lot of times we just want to know what can we do to help the community. So hopefully today, this workshop will help show you the intersectionality of not-for-profit groups, industry, and healthcare systems and what they can do for the senior LGBT population. Next slide, Gordon, please. So why does this segment matter? I mean, you have to think back to our, the older LGBT population. They are our legacy. They are the reason why we have the rights and we can enjoy what we have today. So we want to respect them and cherish all that they've given to us. But at the same time, those of us that are under the LGBT population ourselves, we are going to grow older, and more than likely we're going to age into this subpopulation. So we also know here for the older LGBT population, it's growing at faster rates than previously before. However, there's also a higher rate of aging and health disparities for this LGBT population, and this is a major concern for public health. And one of the biggest things for us is just raising awareness to everyone out there about this segment of the LGBT population and how can we welcome the seniors into our community. Next slide.
Okay. Hi, once again, this is Gordon. By the way, I wanted to add in that if you have any questions, please feel free to put them in the chat and or write them down and we will get to them. What we're going to do is we're going to present, and then after our presentation, we will have a Q&A time. So you're looking at something that I would imagine all of you have seen a number of times before, especially since this is the last workshop in the series here. And that is, of course, the acronym LGBTQIAA. Now, although you've seen it many times before, I can say as a retired language teacher that reviewing words and acronyms is important for us to understand what they mean, regardless of how many times we do it. So I want to start with two very important terms, and those are gender identity and sexual orientation. And the reason these are very important for us to understand is they are fundamental characteristics that all of us have. And gender identity is the gender one feels they are on the inside. And many people don't think about this unless the gender they feel on the inside of themselves is not the same as what they see on the outside. My best friend, whose name is Tamara, is transgender. I remember in high school having a discussion with her where she said, Gordon, you have to understand, I look in the mirror and I do not see the person I am. Sexual orientation, on the other side, is one's primary physical, romantic, and/or emotional attraction to other people. Again, many people don't think about this unless their inner feelings are not the same as what their society considers the quote-unquote norm. My answer to her when she made mention to this, after we talked about it for a while, was, well, gee, I have these feelings inside of me, even though I date girls, that I'm really attracted to boys. And again, that made me really start to think about the differences. We then have two gender identities. People who are cisgender, these are people whose gender identity, how they see themselves, is aligned with their assigned sex at birth. I see myself as a cisgender male. I see myself as a male. I identify as a male. I have been a male since I was born. Whereas transgender people, they are people whose gender identity is not aligned with their assigned sex at birth, which would be the situation with my friend Tamara. Okay? By the way, we have a little background noise. Not sure where it's coming from, but thanks to mute if you can. Okay? So from there we go to, again, some terms of sexual orientation and just under other terminology. Again, terms we've all seen, but this is essentially what LGBTQIAA is about. We have the term heterosexual, which is a person who's attracted to someone of the opposite sex. We have the term lesbian, who is a woman who is sexually attracted to other women. We have the term gay. That is a man who is sexually attracted to other men. Now, in the case of LGBT older adults, and I've heard this actually from other people, sometimes gay is used to mean just attracted to the same sex. For example, I have a friend who is a woman in her 70s, and she identifies as a gay woman. We then have bisexual, a person who is sexually attracted to both men and women. We then have the term questioning, a person who is not sure of their sexual orientation and/or gender identity. And then we have a very interesting term, the term queer. And this is a term for individuals who are essentially LGBTQI, and essentially it's someone who is not necessarily heterosexual or cisgender. It is a term, and I say this as a retired teacher, that is used very openly, wonderfully openly, by young people. That said, for some older adults, it is a trigger word, and because it was a word that was used to hurt them, they tend to shut down. So I would say, and I say this in my interactions with older adults whom I'm just meeting, that I'm careful about using that word simply because I want people to be open with me and not close down. We then have the term asexual, and that is a person who identifies as not being sexually attracted to others. We then have an ally. That is somebody who supports LGBTQIA people. And the final term we have is intersex. And intersex is a person who is born with both male and female traits in their genitalia and or their internal anatomy. The term that used to be used many years ago was hermaphrodite. It is not a term that is being used anymore. Now, one thing I want to say about all the terms I've been using, they are fluid. And what I mean by that is language does change. So what these words may have meant, okay, a year or two or three ago is not necessarily the same as what they mean now. It's one of the things that keeps looking at language like this very, very interesting. So there we have LGBTQIAA. And now, Drew, I'm going to give the floor to you to discuss issues facing LGBT older adults.
Hi, thank you. I'm Drew Werner. I work with Johnson & Johnson in HIV pharmaceuticals, and I'm also on the national board for SAGE that Gordon was talking about. And SAGE actually used to be an acronym, but it now is just a word. But it's still advocacy and services for LGBT elders. And like Gordon mentioned, the Q with SAGE is intentionally left off because the demographic that's served by SAGE is older adults, and queer and questioning are not good fits for this demographic. So anyway, there's that. But that sort of leads us to where we're going with pain points, and there's different language that's used for younger people now versus language that's used for older people, and that's just one example of difference. But LGBT older adults have lived with discrimination and isolation for so long, and you have to remember that this is historical. So the effects on your psyche when you're told you're wrong and deviant and bad and you're not loved and you can't go to church or whatever, that when you grow up with that, it makes there's some damage that happens to people that is carried through even into their older years. And we'll get to some of that because that can go to healthcare. Like LGBT older adults are less likely to turn to facilities and to care than their heterosexual counterparts. But we'll get to that in a minute. There is a need for broad range legislation to address and call out the specific needs for older adults. And this is for all older adults. And that's what you see in the bullet point about the Older Americans Act. And there it is. The Older Americans Act it keeps older adults healthy and independent. It provides for services like meals, job training, senior centers, health promotion, benefits enrollment, caregiving support, transportation, and more. So it was passed in March 2020, unanimous bipartisan support. So that was something cool that happened during the pandemic. But can you go to the next slide, please? Yeah. So we'll just look at some of the statistics on LGBT older adults. That LGBT older folks are twice as likely to be single, twice as likely to live alone, and 4 times less likely to have children. And where that really stands out, the importance of that is when you think about who are the default caregivers for someone. That would be their spouse or partner, and or also their children. And so that makes care in older years more difficult for LGBT older adults. The population is growing from 3 million In 2020, it's estimated to be 7 million by 2030. And some interesting pieces from AARP that 64% of older adults have witnessed or experienced age discrimination in the workplace, and 20% felt they didn't get hired because of that, and 16% were fired because of their sexual identity or their gender identity. So and what we're seeing across the board is older people are working longer. That they're not retiring as early as they used to, and so some of these things are impactful for LGBT older adults because the discrimination group that they grew up with stays with them. So their peers keep in their head about the negativity that was that they grew up with. You go to the next slide, please. So yeah, so some other numbers: 60% of LGBT older adults feel a lack of companionship, and then that actually speaks to the bottom right corner, that the risk of long-term or chronic isolation and loneliness is equivalent to smoking 16 cigarettes a day. So it's actually bad for your health to be alone. And so one of the ways that that's been addressed is with, like, SAGE has a program called, it was called Friendly Visitor, where volunteers would be paired up with a senior to go into the home and visit with them. Now that's changed to SAGE Connect, where people are connected by phone and they call or do Zoom or something once a week with an older person. And the benefit of that piece is that because the Friendly Visitor program was pretty much isolated to New York and a few other cities, but with the SAGE Connect, where people can call, the seniors in even large towns and small towns are being able to connect and get out of isolation, because there's something, let's see, maybe, no, it's not the next slide. That one of the problems with isolation is it's especially bad in parts of the country that are very conservative. So, like, basically the more conservative states, it's harder to be LGBT, because it's harder to feel open and out about that. So Gordon, yeah, can you go to the next, down one?
That one, next one.
The red one. Yeah, there we go. So important for everybody to remember is the effect of HIV on the LGBT community, but particularly the older adults who were not around. They didn't have PrEP, and when we were talking about the effects on your psyche about discrimination, the effects of also watching your peers when you're in your youth. Wow, that caught me off guard. Watching them die is tough. So, wow, sorry about that. I didn't expect that. But older adults are there's a growing number of HIV positive new infections who are over 50. So over 50% of people with HIV are over 50 years old, and 15% of all new diagnoses are seniors. So that's partly because the PrEP is not available for everyone, and again, the age demographic of people not having access to PrEP is still troublesome. Then there are also some statistics in the top right about HIV infection in African ancestry and Hispanic people, and just the long and short of that is that it's not skewed with the regular population, so it's disproportionate infection in people of color. So that's something to attend to. So fortunately now there's a lot that could have been said about our transgender population, but since I'm not the expert, and Jackie has done a lot of work and presentations on the topic. So ladies and gentlemen, Jackie Barr.
Good afternoon, everyone. I'm Jackie Barris. I'm the LGBT Health Navigator for Robert Wood Johnson University Hospital. I myself is a transgender woman, so I have this lived experience that I can share with you from the perspective not only as a transgender woman, but also as a healthcare provider. I am a professional registered nurse, and I work hand in hand with multi-specialty in our hospital, treating and dealing with all the trans community. So I think what Drew is mentioning is, I think, one of the biggest words that we always hear pertaining for the LGBT in general, and that is the health disparities. This health disparities, as defined by the Center for Disease Control and Prevention, that it is the variations in the health that negatively affects the group of people, such as the LGBT, who have been systematically experienced such a greater social or economic disparities or obstacles to health that historically linked to discrimination or exclusion. As we all know, that LGBT is a heterogeneous population with such a collective and unique strengths and challenges. We know that the disparity exists in this group when compared to the general population of older adults. But I just want you to be mindful that even though the experience of social stigma are not consistent across the subgroups, what do we mean by that? LGB primarily may experience all these disparities, but if you look at the trans community, they have higher increase of incidence of victimization and internalized stigma as compared to the gay women, gay men, lesbian, bisexual. So transgender is pretty much down below there, that experiencing more than the non-transgender peers. And also, we cannot put them in one pile. Transgender older adults differ from the transgender group. And what do we mean by that? That the trans women older adults have different disparities compared to transgender older men. So even in a group of trans community, they experience a lot of disparities. And more so, if you dissect this group, you can see that transgender experience more of this health disparity. Next slide, please. So I'd like to focus on 3 issues that most transgender and older adults experience in the United States. In 2011, there are 2 reports that basically discuss thoroughly and comprehensively the transgender older adult disparity. It is from the National Transgender Discrimination Survey, and it's from the Aging Healthcare Report. So the first one that I'd like to focus on is on disparities on healthcare. It has been reported that 18% of the trans community do not want to go to the doctor's offices or even visit their doctors, primarily because of fear of discrimination. Not only the fear of being discriminated by the offices, but the sense of being embarrassed in the community, particularly when you're visiting a doctor who is not welcoming, affirming, and inclusive in terms of understanding the needs of the transgender community. 24% of the trans women and 20% of the trans men somehow experience care refusal from healthcare because not all doctors are competent in terms of billing the needs of the transgender community. 32% of the trans people of color in particular have reported unequal care from the doctors or hospitals. You know, they are most vulnerable to violence and abuse. You know, that's the reason why I said, even if you put us in a group of transgender, all of us experience this kind of disparities, particularly the transgender people of color. 50% of the trans people reported that they felt that they need to teach the doctors about the transgender care. Absolutely, particularly in areas where probably the care is not as good when you go to the city or, you know, suburban areas. We're talking about the rural areas where doctors may not have received any training or, you know, training and knowledge about the transgender care. And lastly, of course, not only the healthcare access, but think about insurances. You know, if you don't have insurance, there will be challenges in terms of refilling your prescriptions, and more so that they will end up going to the emergency department as the last resort for their primary source of care. Next slide, please. So the two things that I still want to include in the disparities is the employment and housing. I think Drew mentioned that, in particular, the gay, lesbian, or bisexual experience 64% discrimination in terms of employment. But look at the transgender community. They experience transphobia discrimination at work by almost 90%. 70% of transgender adults feel that they would rather wait, get their retirement before they even transition, because they are so afraid that they will experience discrimination if they want to transition while at work. 26% lost their job, okay, due to the anti-trans bias. And because of this, it will result to multiple disparities, the long-lasting effects of discrimination and isolation, and more especially losing this employment. One of which is the use of drugs or alcohol. 26% of the trans community are ended up, resulting from drugs or alcohol because they lost their job. Increased use of cigarettes, okay, and less likely to say that likely to have an increase of unsafe sex, ended up to be high vulnerability to HIV. And you have to understand also, there are a lot of transgender women in particular ended up going to a sex work because of unemployment. So for us to survive, we need to do something, whether it's appropriate, inappropriate, that's survival. We need to ended up, doing things that for us just to move on with our lives. 41% of transgender adults also have contemplated suicide. Think about it. If you have no hope on how to live in this world, you don't have a job, you don't have, you still continue to feel discriminated. A lot of them ended up having contemplated suicide. 41% as compared to 1.6% in the general population. That is pretty high. So, and the other one, the disparity that they experience, or we experience transgender in general, is housing. 19% of us have experienced, evicted, or either we lose the home or apartment primarily because of our authentic selves. Dealing with our gendered identity is not only dealing with ourselves, but the external conflict that we experience from the society. 44% homelessness were sheltered and 56% were sheltered, which means 30% transgender in New York experience they are more sheltered compared the ones in California, because in California 73% of all transgender are not even sheltered in California. So what we're trying to say here, think about social determinants of health. The resolution to that is we should be given an opportunity to have employment. If we have job, we will be able to take care of our family. We will be able to take care of ourselves because we can have insurance, we can have a good food on our table, and we can have a better life. But the society is still not embracing, particularly with the transgender older adults. So with that being said, I'd like to bring back the presentation to Mr. Gordon Sage.
Thank you. Hi. So now we're going to talk about a very important term. It is called intersectionality. And we've been talking about LGBT plus older adults and their needs and their challenges. But now we're going to talk about intersectionality, because as with gender identity and sexual orientation, this is a factor that affects all human beings and how they relate to others. And here's a definition of intersectionality. It is the concept that we are all a combination of different societal factors that influence who we are, our experiences in life, and how we interact with others. Factors include, but are not just limited to, there are others, but factors include culture, race, color, religion, age, education, economic status, gender identity, and sexual orientation. And in the case of an LGBT older adult, these factors, in addition to their being LGBT, influence who they are and how they interact with others. I have to say, for me, for example, as a gay, white, agnostic, cisgender American male, my life experiences and interactions with others may very well be different than those of a gay, Pentecostal, Hispanic, immigrant of color. So, given that, I'd like to introduce you to Freeman. And Freeman's going to talk for a moment about himself. And if everybody could think for a moment what factors might influence who he is and also influence his relationship with other people.
My name is Freeman, Thomas Freeman. I was born 8/27/39, so I will soon be 76.
And you identify as a gay man?
Yes, I do. If I could go back in time, I would tell my younger self to start earlier in life, accepting my sexuality and confronting people who had some struggles with it. It would have just eliminated those years of having to stay so attuned to how people respond to me. So how much can I let be known here, and how much there? And of course, for me, race was always an issue, as well as my sexuality, in terms of how am I going to get along in the world, how am I going to confront racism and issues about my sexuality. And sort of felt like when I was confronting one, the other one would come up, or vice versa. So I would tell my younger self to start out earlier, being brave about stating who I am and accepting the consequences earlier, so that I could be used to it and know how to armor myself against the wickedness that one comes into contact with.
I think that's very interesting when I hear him say against the wickedness that one comes into contact with. For me, when I listen to this, I see two issues definitely that he talks about that really do affect who he is and his relationship with others. And those are his sexuality and his race. Another one could be his age, also could be, for example, where he was employed and where he lives. Another factor, by the way, that affects everyone, and I was thinking about this today in regard to the age we are living through, is the historical events that occur during a person's life, because this also makes up who we are. And in that vein, I'd like you to meet Carla. By the way, Freeman is still very much alive. This was done in 2015. My math is not good, I believe now 81. And Carla, who is 78 here, is now 83. So let's take a look at how do the historical events during a person's life affect them. And now we'll get to meet Carla. And Carla's born in 1937. Well, during that time, it was World War II. LGBT people are being killed in Nazi concentration camps. She's 16 years old in 1953, when President Eisenhower calls for the dismissal of homosexuals from government service. She's 32 years old in 1969, when the Stonewall riots take place in New York City. She's 36 years old in 1973, when the American Psychiatric Association declares homosexuality is not a mental disorder. Personally, I have to say this one really resonated for me, because back when I was talking to my friend Tamara that I mentioned previously, I had looked up in a book because I wasn't sure about who I was. And I happened to find an article by the American Psychiatric Association, this was around 1971, that basically told me that I had a mental disorder. Imagine now, you know, the feeling that a person would have. And I can tell you, it did definitely affect my coming out for a while to come.
Over the next two sessions,
We go back to our meeting.
Okay, hi, just got a little, somebody got a little interruption there, that's okay. So in the 1980s, Carla is in her 50s. The 80s were the height of the HIV/AIDS epidemic. And in 1959, in 1990 rather, Carla is 59 years old in the 1996. And DOMA, the Defense of Marriage Act, is passed and signed, prohibiting the federal government from recognizing same-sex marriages. In 2003, Carla is 66 years old. And here, the US Supreme Court invalidates the remaining laws that have been criminalized or that had criminalized same-sex sexual acts. So imagine, if you were, it took till 2003 for it to become legal for, in some states, for two consenting adults of the same sex to have a sexual relationship. In 2015, when Carla was 78, the US Supreme Court extended marriage equality to all 50 states. So, what impact might all these historical events have had on Carla or any other LGBT identified person who lived through them? Well, they came of age at a time when there was great prejudice and violence against LGBT people. Certainly that medical label of mental disorder validated the prejudice. This history and this whole history of hiding oneself may make people, and does make people, less willing to be open about their LGBT identity. And that creates persistent stress, which may contribute to health disparities. So now I'm happy to say that Carla has a strong community of family and friends and other SAGE members, and she is now, if I have my math right, 83 years old. So now we'll speak, or I should say Vanessa will speak to us about having a culture of inclusion. Vanessa?
Thank you, Gordon, and good afternoon or good morning, wherever you are listening to this presentation. I am honored and privileged to have a few minutes to talk a little bit about the journey we've been on at Robert Wood Johnson University Hospital and RWJ Health, which is a large healthcare system in New Jersey. And thanks to my co-presenters here who did a fabulous job putting this presentation together. So today you've heard a little bit about health disparities, barriers, social determinants of health. And for us as an organization, what I wanted to do today was share a little bit about the journey we've been on. Now that we know what some challenges are, right, to creating a safe environment, what are we doing to sort of support the community who are walking into our space, i.e. our hospital, right? Because we now know, right, we have the data, we understand, that there's barriers, there's not a lot of trust with the LGBTQ community in terms of physicians. So what are we doing and what have we done? So I'll share a little bit, and again, this is just a little bit about our journey. And Gordon, if you can advance the slide. And I call it a journey because every day, right, is an opportunity to engage, to learn more. And one thing that I've learned being, in diversity and inclusion for several years is never to assume anything, right? So for us, it really started with our commitment to building a culture of inclusion, not only for our staff, but for our patients, which includes the LGBT community and older adults. So, it really started from what I like to call from the inside out, and developing and adopting a very comprehensive diversity strategy. And one of the first things we did was, let's engage our own employees to better understand what are the challenges that are out there facing the community. So one of the BRGs that was formed early on was a Proud BRG, and you heard from Jackie Barras, who was one of the original members and now is the co-chair, very much engaged. We just won't let her go. She can't go. We won't let her go because those insights from those employees, when we started this journey, were hypercritical in sort of understanding what are the gaps, what are the gaps to entry to make sure that we understand, what do we need to do for our sort of organization to create a safe environment. So I talk about, having those listening sessions, talking to your employees, understanding, what is it that you think we should be doing to create an environment where you want to come to work to, right? That you can be your authentic self. And if you're out, transgender, LGBTQIA+, bi+, which I love the chat because I'm learning a lot of terminology that's being shared in the chat. So thank you for those that are sharing in that space. We conducted a cultural audit, right? So that's that process of learning and understanding, with the knowledge that we don't have all the answers, but listen to your employees who do represent these voices to say, okay, these are the things that we should be doing. So one of the first things was absolutely commit to LGBTQ+ education. For us at our hospital, this was actually mandatory. And it was rolled out across the entire franchise. So when you talk about 45,000 plus employees, that pretty much just was part of their mandatory education, that's commitment, right? That's commitment to make sure that you understand, and can be culturally sensitive to your patients, but your staff. So quite frankly, so that is something I always recommend, is to make sure that you do have some form of training for your staff, because you never ever want to assume that they understand, that they get it, right? Even today, just in this conversation and seeing sort of the conversation happening in the chat and people saying, queer is an outdated term, but it's not, some people use it. That's learning, right? That's engaging. And one of the other things we did was we actually incorporated as part of new employee orientation. So every single employee that comes into our hospital as a condition of employment has to participate in LGBTQ+ education. It's a non-negotiable for us, right? Because again, we can't say we're committed, we know we want to do this right, if we're not even educating our own staff about, the ins and outs of how to be culturally sensitive. So absolutely, that's a recommendation. Think about incorporating as part of your new employee orientation. And if you have volunteers coming into the hospital, they should also be exposed to this conversation and this dialogue. So I can't stress enough, again, that really, take the opportunity, if you're an employer, no matter what the size, listen to your employees, gather that cultural intelligence in terms of what are the things you need to do to create a safe and affirming environment. So people come to work every day bring in their best authentic self, and whatever that means for that person, right? And that's how you retain staff. So Gordon, you want to forward?
Yep.
One more, yep. So again, when we talk about creating an inclusive culture, what I am sharing here are just some of the, several things that we've done in our space, again, to sort of support this whole strategy, this whole journey. So for us, we updated our registration system, our medical records, to now include gender identity and preferred name. And I think, as you heard my colleagues talk about, social determinants of health, health inequities, to not be able to identify yourself the way you want to be identified with a healthcare provider, to me, that's a place that you can start. So we made sure we updated our systems to incorporate that, capture that information right from the onset. So when that patient walks around the hospital, they might be legally known as one name, but prefer to be called, based on their preference. We acknowledge that, and that's the name we're going to use, right? That's commitment to change. And obviously, that takes training, education, alignment of our clinical staff, of our physicians, but it goes back to the commitment we made as part of our strategy, right? If we're going to do this, we're going to do this the right way. It's a non-negotiable. The other thing is gender neutral bathrooms, to make sure that you're highlighting them, that you have clear signage of where these bathrooms are. So that way, again, if there's a need for someone to use the lavatory, that they can, be free to choose that bathroom and not have to make a choice, if it's a male or female. And, I know that, sometimes where there's transition, they just feel more comfortable and safe using gender neutral bathrooms. So that's the kind of stuff we're talking about, and not have to have people, sort of guess at it. We talk about inclusive marketing, and Robert Wood Johnson University Hospital and Barnabas Health. And you can look this up. We actually have a lot of advertisements that really reflects the LGBTQ+ community. We post in different magazines, even job postings as an example, because again, one of the things I always sort of highlight is what we don't want is to raise the flag during Pride Month and the flag comes down, and then that's it. Like, that's all you've done. But someone from the community comes into your space and they're not received well or treated with respect and dignity, right? So again, you have to make sure that, you know, you're sort of backing all this stuff up and really walking that walk. We honor and celebrate key LGBTQ dates. I talked about Pride Month, Transgender Day of Remembrance. You know, there's just so many dates that are so significant for this community that as an organization, as an employer, you know, we make sure that we honor and celebrate and bring awareness. Because again, commitment to education, you know, lifting people. The other thing I talk about is coaching staff. You know, so yes, you know, we've done tons of education. We've even done role-playing sessions with our registration team. You know, we've had members of the community come in and do role-playing sessions, so that way they can practice sort of asking the questions and getting, you know, confident and comfortable with asking the questions. But you know, there's consistent coaching that needs to happen for them to make sure that, you know, they stay sort of apprised of, you know, on top of, you know, our commitment. So as a leader in diversity, along with a few other folks, we're always sort of serving as resources for our registration teams. So they know that they're not by themselves, right? That they're not by themselves, and that we have people on board who are really willing, able to help them and coach them through. So that way they better understand. Again, it's all about providing that support. The last thing I have here is HR collaboration. You know, so one of the things we've done is I work closely with our human resources, and it would behoove those on the phone. Again, if you are an employer, you know, in the space, that you work with HR to make sure that you're looking at your policies, your procedures. Does it have inclusive language? Do you allow an employee to have their preferred name on their badge, right? Even though legally, again, they might, you know, have not gone through the process of changing their name, but they want to be acknowledged by a different name. You know, make that available to the individual. That's, you know, creating inclusiveness. That's gender affirming in many cases. But again, you know, it's a collaboration. It's not done in sort of some vacuum. You have to work with your partners. So I talk about HR, I talk about marketing, I talk about leadership as part of my points today, because, you know, this is not a, you know, Vanessa Nazario diversity leader sort of a lone journey. It takes a lot of people to make sure that we're aligned and committed to this so we can get it right. I mean, the fact that I'm here sort of presenting today to you fine folks there, wherever you're at, right, sharing, that's commitment to say, let's share, you know, so there can be some best practices out there so we can do this as a community that supports and celebrates one another. Because at the end of the day, you know, and I've had this sort of conversation with many folks and I've asked the questions, you know, when someone comes into the hospital, what are they looking for? What are they asking of us? And it comes down to a very basic sort of response. We just want quality healthcare, free of bias and discrimination, right? Where we receive the respect and dignity, and we're not looked at as we're, you know, some kind of odd people or anything like that. So fundamental, so basic, right? But as leaders, we have to make sure that we're preparing our teams and our staff to honor that commitment. So I'll be turning it over now to Sean. I'm sorry, who am I turning? Oh,
Shane.
Shane. I was gonna say Sean. I'm renaming you. I got so emotional. I'm like, yes, yes, yes. So thank you for the opportunity to present.
No problem. Thank you, Vanessa. Kind of in summary here, as we, you know, wind down this workshop, thank you, Vanessa, Jackie, Drew, and Gordon for great presentations. The one thing about this older LGBT subpopulation is we need the support system, because we've given examples here from our not-for-profit organizations and use SAGE as an example, healthcare system, Robert Wood Johnson, industry. I'm coming from Johnson & Johnson with our employee resource groups, and each of us can provide a lot of support towards the older LGBT population, but we can't do it alone. We need everyone together. So this takes a village. I'm hoping for everyone out there, at least today, you can see some examples of what we were able to do in New Jersey and New York, and how we all can contribute toward things. And hopefully you can at least get an idea of what you can do. Take that back to your region, wherever you're located, because there should be industry there looking to help. There should be a healthcare system in every region of the country, and There's also the not-for-profit groups. It's just a matter of, these are examples, and hopefully you can bring together your own group wherever you're located. Gordon, next slide. These next 3 slides, I'm just going to kind of walk through a little more of a summary of what can each of these sectors offer. The not-for-profit groups, I mean, a lot of times these groups are a way to mobilize the LGBT people and, you know, talk to the allies, talk to the subpopulations, find out what rights are at stake. Another big thing is looking at these issues and helping to educate the policymakers. I mean, for a lot of us, we didn't even think of the older subpopulation as we should worry about it. We had always been focused a lot more on the youth and young LGBT and HIV awareness and prevention. And if we're thinking that same way, the policymakers are not thinking about this older LGBT population. So educating them about the issues, being able to release policy briefs, publications, ways to educate the public as well as the policymakers. And also, you know, when we have these conversations, when we're out there, getting actual representatives from the senior population into the conversation so people can hear firsthand, what are they going through? What are their pain points? What's going well, and what can we do to improve things? And then just getting out there and participating, you know, being at the marches and rallies and trying to work with the older people and the allies to get things moving forward. Gordon, next slide. Jackie and Vanessa were also for the healthcare systems representing Robert Wood Johnson. There's a lot of things the healthcare systems have to offer. You know, they're looking at ways to improve care. Also, this whole discrimination, we know it exists out there, and how do you confront it? Just being able to provide the seniors with affordable, but also community health needs assessments. You know, coming back to primary care, how do they get some various healthcare? I mean, one of the biggest things I know from discussions with Jackie and Vanessa was just trying to create an environment where they feel like it's a safe place they can go. A lot of places might have all this stuff, but if the people don't feel safe going there, they're not going to go. So how do you make it more welcoming? Also, I mean, especially for the older LGBT, and especially for the transgender, like Jackie said, a lot of them are not going through the transition until after they retire. So having access to that hormone therapy and monitoring, and a lot of things that people take for granted, just wellness exams, a chance for sick visits, same-day sick visits, chronic illness management, just trying to have, especially, how do you connect with specialty service such as behavioral health services? Because the one thing, loneliness and depression is such a big thing that the older adults are dealing with, and how can you get them help? How can they go talk to someone? How can they help eliminate and alleviate some of the symptoms that they're feeling from the depression and loneliness? And just health education, counseling, and support. These healthcare systems have so much to offer to things. Next slide, Gordon. And for me, coming from industry, you know, Johnson & Johnson, one of the things we've always having employee resource groups, and we want to give back to the community. And a lot of times, you know, we've always asked ourselves, like, we want to help the community, but we don't know what to do. And so for us, what we've been able to do is be that connection point. We can reach out to the not-for-profit groups. We can reach out to the healthcare systems. We're kind of a connection point there. And what we, as a company or industry, we have a place where we can hold conference settings, especially pre-COVID. We could set up team meetings at our conference centers. We We had the audiovisual equipment. A lot of times ERGs have budgets to help the community. You know, we could set up events, provide food, swag, I mean, educational materials. A lot of times the not-for-profits, even healthcare systems have limited budgets, but what can we do to help them? You know, we can develop programs, like once we find out what each of these areas need, we can set up programs and invite the not-for-profits and the healthcare systems, just recruit other community partners, other, you know, I mean, it's a way to connect not-for-profits all in the same region and other hospital systems. The more you have involved, the more you can get done a lot of times. And, you know, the next one's like when you're looking at how do you educate people, can you set up speakers to talk about topics that are of concerns, and you have money to bring in some high quality speakers or experts. Provide resources to help them understand what their topics of concern. One thing we did was actually set up some kind of a brainstorming session where we brought in, for the youth, we brought in GSA advisors and we talked about what their pain points were, and we're looking to potentially do that with senior LGBT population, and hopefully we could find out within our tri-state area of Pennsylvania, New York, New Jersey, find out what are some of those issues that we can tackle. And then ultimately here, for us coming from industry, is we want to help the community, and a lot of times we're passionate about what we want to do, so be passionate in our efforts to help the senior LGBT. And Gordon, next slide. I think this might come to our resources.
Okay. Yes, resources. We're going to be showing you some in the next couple of minutes. And all of these are included in the files section for this session. But that said, I will give a moment or two for each slide if people do want to take pictures of them. And the first slide is SAGE with SAGE National Programs and Resources. And just as a little background, we are a national organization. We have 31 affiliates in 22 states, the District of Columbia and Puerto Rico. And we have a variety of programs and resources. One which is SAGE Care that provides staff development and training. We have SAGE Connect, which is a phone connection, and this is outreach in the new normal of COVID-19, where we call seniors in different parts of the country. I happen to be a SAGE Connect volunteer on a weekly basis and really, you know, bring together a bond with them. We also have the Friendly Visitor Program, where people go to people's homes and visit with them and give them the companionship and support they need. Something new in SAGE is called SAGE Sense, and this is financial advice for LGBT older adults. We also have our LGBT Elder Hotline. And one of our really best resources, in my opinion, is the National Resource Center for LGBT Aging, where you can get information not only about resources nationwide, but also in one's individual state. And then finally, of course, there is our website, which is www.sage.org. And this, which you can't read, I'm sure, is actually, and again, it's in the file, in the files for the session, are the statistics or SAGE resources. These are the links for them. It gives you some idea of some of the links that we have. Again, please go to the files and you can get these resources or these links for yourself. And then we go to the Proud Center of New Jersey, which Jackie, if you could give us a little bit of information, that'd be great.
Yeah, I think Vanessa can chime in on this also. So welcome to the Proud Gender Center of New Jersey. Amidst of the pandemic, we launched the Proud Gender Center of New Jersey last August 13. This is a center where we have a multidisciplinary specialization of our surgeons, doctors, who are really looking into the needs of the transgender community and non-binary. So basically, this is a collaboration between the hospital and the Rutgers Health, which is one of the biggest medical school that we have here in New Jersey. So this is a collaboration. This is a partnership between the two big R's in New Jersey and create a center primarily to address the needs of the trans community and non-binary. Aside from the medical and surgical services that we provide, we also have, we provide also education and training. And as you can see in this slide, we also have support group. I call it Proudly Me. It's a combination of a education support group that we usually have it every second Thursday of the month. The last one we had was last night, and we're doing currently virtually. Me and Vanessa also facilitate what we call the Proud Community Advisory Panel, which composed of the members of the community who identify themselves as the LGBTQ+. Primarily, they give us some consultations. They become, I think Shane and Gordon are part of this, basically provide us some ideas and inputs to create some programming for the hospital so that we can have a continuous journey for the community. And also lastly, we also have what you call the Proud Business Resource Group. You know, some of you may have ERG, but we call it the Business Resource Group. These are LGBTQ+ identified employees of Robert Wood Johnson, looking at opportunities on how we can improve our workplace environment, not only for the employee, not only for our patients, but also for employee. And one of the greatest achievements we have is that if you would like to transition while you are employed by Robert Wood Johnson, your medical and surgical are 100% covered. So those are things that really we are proud for the accomplishment at Robert Wood Johnson University Hospital. So if you have any questions, give us a call and we'll feel free to provide you all the resources that we have in New Jersey. Thank you.
Vanessa, is there anything you'd like to add, or have we covered everything?
Just the only other thing, so you see in the middle of the slide there, the LGBT healthcare equality leader. And I share that, and I wanted to highlight because that is something that, you know, any organization, particularly healthcare organizations, can go after, and that's by the Human Rights Foundation. You know, they're the largest LGBTQ+ advocacy group in the country, in the United States, and they do have a process where you can actually be designated as a leader or as an employer of choice for the community. And I'm just honored that our hospital has, for the 5th year now, been, you know, designated as leaders. So when we talk about, you know, walking the walk and not just, you know, raising a flag and not really backing it up with anything substantial, we really honestly do. And hopefully, you know, we've been able to convey that by way of this presentation. You know, we proudly call ourselves leaders, but it really starts with, you know, listening to your employees, taking the time to understand your patients, and delivering, you know, patient-centered care. And obviously, you know, it's a team effort, and I cannot stress that enough. It's been a team effort. So I'm just delighted and proud to, you know, be part of an organization that really is committed to this. So thank you, Gordon.
Okay. So next we come to contact info, and again, you will find this if you go to the profiles in our session, but again, I'll give you time to take a picture because I think things are maybe put a little more concisely here. And this is me. By the way, I do have 2 contact emails. Yes, I have Earthlink, believe it or not. But the other one that you can use is gordon@hudsonpride.org. The Hudson Pride Center is the center where SAGE is located, and you can certainly call and text me. Then we have Shane. Anything, Shane, you want to say about your contact info?
Everything's right here. I mean, there's an email, and, you know, I mean, if you have any questions about employee resource groups and how to interact with the community or anything else, just feel free to email me.
Okay. Vanessa, anything to add with your contact info?
No, just you have the information for the Proud Gender Center here. And the brochure that we took a screenshot of is actually in the resources tab. And that, you know, what Jackie was talking about has all the positions, all the different sort of clinical and medical components of the Proud Gender Center that we currently do in New Jersey. So please, you know, you have our contact information and we're always available to answer any questions you might have. Thank you, Gordon.
And Drew.
Hello. Yeah, thank you everybody for coming to today's talk. It was a lot of fun. I'm Drew Warner. I live in Miami. I work for Johnson & Johnson, and I'm an active member of Open and Out like Shane. And I'm also on the national board for SAGE. And the website for SAGE, which is the best jumping off point to get a lot of resources, is www.sageusa.org. So sageusa.org. And again, one thing that SAGE has done that I think is really important is they have changed a lot. They've changed all their live programming to virtual, but they're also serving as a resource for other organizations and groups who need help on how to best approach a COVID world for their older adults. And SAGE hopes to be the how do they say it? The LGBT voice in the elder community and the elder voice in the LGBT community. So anyway, thank you.
Okay, thank you. And Jackie?
Hi, so thank you for joining us today. Thank you for being patient with us. I hope that you are bringing something out of this presentation. And I hope that wherever you are, you will continue to advocate, not only on your LGB, but advocate for the transgender populations as well. Because I think there is truly a need for us to be united as one. We stand as one, we should stand with solidarity, and we need to continue being safe and well in the midst of this pandemic. And we need to treat each other with kindness and courage. Thank you.
Thanks, Jackie. So now we come to our question and answer time. And Drew is going to be the facilitator for sharing the questions from the chat. We're also going to give you a little time. It's a large group, so we'll have to see what we can do here to present your questions to us directly by raising your hand. We'll recognize you, and then we can go from there. But before the Q&A, I just want to share one very important question and its answer. And that is, what can we all do as a group for not just LGBT older adults, but all older adults? And one of the things that we can do is we can provide companionship and support when they have no family or friends around to care for them, excuse me. So in that spirit, I now open this up. I'm going to stop my share here. Let's see what happens. Oh, we have a whole big group of folks. And I will turn things over to Drew. So Drew, please feel free.
Okay, we have, there's a lot of different comments and a few questions. But first, welcome to all of the attendees who are joining us from outside the U.S. Welcome, yay. Let's see, there were several comments about the language used for identity, gay, lesbian, those concepts, those ideas. There's a question about the slide deck and yes, it will be available after the presentation. Interesting work being done in the UK by Opening Doors London and Toxic Living, and Bank of America has been connecting with Opening Doors London recently and volunteering as telefriends during COVID. So that's some cool work in the UK. Some people here have been in isolation since March. So events like this conference are highly welcome. Let's see. looks like some of the statistics were surprising to people. That, like, for example, the thought was that LGBT people are in better health than their straight peers, but that's not always the case. And so anyway, do we want to talk about any of these things, or you want to just read the comment, Gordon?
Yeah, I was going to say, first of all, do we have any specific questions? I see a couple of things.
I'm getting to there's some questions like, is PrEP available on Medicare? And yes, the answer is yes. Medicare Part D. And then there was also, so PrEP is 2 medications in 1 pill that was originally designed for treating HIV, but it can be taken by itself to prevent HIV infection. And the original drug was called Truvada, and Truvada is now available in generic form. So there shouldn't be any trouble for people getting access to it. They need to talk to their doctor, of course, because there are some people, if people have certain conditions, like maybe if they have kidney disease, it's not a good idea for them to be on PrEP. But anyway, that's is PrEP available on Medicare? Yes. Medicare, Medicaid, both.
We have
yes.
a raise hand. I think we have Chelsea.
Okay.
Chelsea, hi. Thank you for joining us.
Hi, yes, my name is Chelsea. My pronouns are she, her, hers. This has been one of my favorite sessions all week, so I just wanted to say thank you to everyone that presented. I'm feverishly taking notes. So I live in Chicago, Illinois, and I'm planning on reaching out to people within SAGE and these different communities, but what would your advice be for people to get more engaged with their communities within like their own spots in the country? And I'm seeing some things internationally. How do I even start to try to be a better ally and just connect? Thanks.
Well, I'll start with some of that. You're in Chicago, right? Chicago has a SAGE affiliate. I would definitely reach out to them. We do something that I think is a wonderful program, and it's called SAGE Table. And this is something where in today's world, we're doing it virtually, but we also have done it traditionally, person to person, where we get together a group of people who are of my generation, I'm 68, and then of your generation, and we sit down and we really just talk about our similarities and differences. And what inevitably we find out is that we have far many more similarities than we do differences. And it's wonderful. The people come out of it feeling very, very, in touch with each other. The elderly people feel very supported, and I can highly recommend the program. Also, I can say, if you do talk again to the Chicago affiliate, you can get information about specifically the types of questions you're answering. How can we be an ally? How can we support LGBT older adults?
Chelsea, I would probably give you a different perspective. What I would like you to do is primarily to identify your needs first, because there's so many concerns and issues that surrounds the LGBT community. So when we all started, the first thing we've done is we reached out to Shane. Shane, remember? So the Robert Wood Johnson, I'm working in a hospital. So what we have done is we reach out to the Johnson & Johnson, because the initial issue we have is how can our employee be more engaged and open and feel safe working in a hospital that has known to be not friendly and welcoming. So that's the first thing we kind of like focus on. When we solidify our foundation, we started looking at different programs. And one of the programs we realized is to create what you call the community advisory panel, where we can bring the community in the hospital so that they can be the voice of the community. And during that time, one of the concerns they mentioned is how do we continue to treat our older adults? So with that, it's continued to explore, our journey. So I think a couple of months ago, we reached out with 3 long-term care facilities. And our community advisory panel did the training for the staff in nursing homes, skilled nursing facility, and assisted living. So I think my point is, ask yourself first, where do you want to bring your group? What is your needs? What is your assessment? So like Shane has done a lot of things with youth, because that's what initially, correct me if I'm wrong, Shane, you have done so many programs with the youth and we got involved. I think Shane mentioned this, you know, you need to start creating community linkages. You can't do this alone. You need to, it takes a village. So by doing that, identify your needs first, look for a similar company or organization, work together collaboratively, make it a solid core group, and then you can start from there. And that's how my perspective is. So.
Okay. Yeah. Yes, we see Hope has her hand up. And then we'll go back to you because I'm sure you have some more questions. I've seen some popping up in the chat. So go ahead.
Thank you. I'm Hope Rivera. She, her are my pronouns. I have had the opportunity to visit Medicaid facilities in the state of Texas, all over. What I notice is our elderly are going back into the closet. My question is this. Well, let me just fast forward. I am now on the LGBT aging in North Texas board. Now, while we have many needs, what I'm seeing is there's really not a whole lot of cross collaboration. Is there a way for SAGE to have leaders in each area so we can cross pollinate our resources? Because one area may know this and another area may know that, and we're just not getting the information to the people who need it, which are.
And that is why thank God for Zoom and thank God for the internet is my first reaction to that. Because Hope, you are so right. And it is a constant struggle to get the information out. I happen to, because my best friend lived in Texas for many, many years, Tamara, the person I was referring to, have been to Texas many, many times. And I have found, you know, definitely have had some frustration finding the support that folks need. That said, you know, one way I think of doing that is reaching out to people in SAGE and SAGE National, and we can have a discussion about whom to reach out. I'd gladly do that for you. I'd also say one thing that we're working on, and you bring up an extremely important point. I'm what's called a SAGE Care trainer, and I go to caregiving facilities and I give workshops on better meeting the needs and understanding LGBT older adults. What we're trying to do in New Jersey, and this is currently in our state Senate, is have a bill which would require this training in all caregiving agencies in New Jersey. Now, quite honestly, I know Texas is a long way away from doing that kind of thing. But that said, you know, we do have training that is available. And what you can do is you can go to SAGE Care. You can contact people. I can give you the name of some of the contacts. There are two people who are absolutely great on that. And that would be a start so that if you find there is a caregiving agency, and by the way, that's not only nursing homes, that kind of thing, but it's also in-home care. We've also worked with some government agencies in New York, for example, I've worked with, and also New Jersey, and the visiting nurses. We may be able to start and get a connection going that way. Okay. So Drew, oh, I'm sorry.
Yeah, Hope, I just want to add to that. And true, we work with Gordon on that. You know, there's a pending bill about the LGBT rights in long-term care facility. I think, like I said, you know, me and Vanessa have started working on reaching out with our older adults. And because the success of our journey as a hospital, because hospital is from children to adults, we kind of build that relationship with a lot of long-term care facility. And what we're doing now, we are sharing the policies for them, because you don't want to reinvent the wheel. You know, if there are long-term care facility, why can't you just share it? Besides, you want to have a continuity of care from hospital to long-term care facility. So at least if they feel safe and welcome to our community, we want to make sure that if we refer them going back to nursing home or assisted living long-term care facility, they will have the same treatment regardless if they are with our facility or not with our facility. I think the bottom line here is we need to make sure, like you said, cross-pollinate, you know, and bloom it. And then I think that's the best relationship you could ever have with any organization.
Right. Drew, we've got about 5 minutes left. So if you can look at the questions there that some people have submitted and see if you can pick out maybe one or two, we could discuss them before we have to leave.
Yeah, there was some commentary about blood banks and discrimination, and questions about the blood banks test for HIV and other diseases for all donations, and I believe they do.
Mhm.
So, okay. Then there was a question or a comment with a question about what is U equals U. That is capital U equal capital U, and that stands for undetectable equals untransmittable. It's a program. It's a global program actually, to get 90% of, well, that's a different program. Sorry, U equals U is to get people on treatment so that then they can't spread HIV. So that's one of the goals for, it's a global goal. Let's see, then ways to connect with seniors virtually besides, oh yeah, there are some regional organizations that are available to help connect to seniors virtually. So that is, that could be, that's useful. Do we want to talk about that for a moment? Regional, we may not have time to talk about regional services.
Right.
But I guess SAGE could probably help with that, or the when you go to the SAGE website, sageusa.org, then you can look for affiliates, and that's where you can find contacts for. It's basically like a local chapter for SAGE. The national organization does national level policy, and the local organizations they're more autonomous than people realize. But there's a lot of good local people taking care of local issues. So they're and Gordon runs the Garden State SAGE.
Jersey City, which is for the state of New Jersey.
Oh, it is. Okay. Okay.
I think
Go ahead.
there's the latest question here for Vanessa. Vanessa, as a successful and well-regarded hospital, do you have a marketing campaign in the works to evangelize the progressive projects to other hospitals? And what venue are you pursuing to shine your light in?
Yeah, so I actually responded to Cypress directly, and I said, feel free to email me, but the answer is that we do a lot of external marketing and social media to raise awareness about everything we do at our hospital, right? Because remember what I talked about, it's not only the internal aspects of our work, but external, letting folks know what we do. And, Jackie and a few others, I mean, the fact that we're speaking on this forum, right? Sharing what we do is a form of marketing and branding. We actually have sessions that we've done virtually to talk about our programs, different health-related issues related to, we have one next week, for example, a Zoom session with some really phenomenal doctors to talk about the impact of COVID-19 on the LGBTQ plus community. So we're always thinking about, raising awareness. Who do we share this information with? We put it on all social media related to the hospital. We blast it out internally to our employees. We share with our community partners. So we're always kind of sharing. And we do receive calls from our peers, industry peers, to sort of ask, like, how are you guys doing this? And trying to learn best practice. So we do share. But if you want me to expound on that, I provided my email, my business email.
Thank you so much. One question that came up from our wonderful friend from Out and Equal, Rebecca, who is our technical advisor here and helped us put on this today. And that is, she says, don't forget to fill out the feedback form for this session. And you can find the link under survey links in the session page. So we would really appreciate your feedback. And please, if you can do that, take the time to do it.
I do have one resource that I noticed was not on the resource slide, and it's worthy of jotting down because it's a jumping off point for national and local stuff, as well as training, news, and all kinds of things. And that is the National Resource Center on LGBT Aging. So it's the National Resource Center on LGBT Aging. And the website address is all one word, lgbtagingcenter.org.
Mm-hmm. Great.
AGING center.org, lgbtagingcenter.org.
Yes.
Cool.
And also, if you go to sageusa.org, you will find that. And that is, definitely highlighted there. Great. Well, I'm looking at the time, and we've got about 30 seconds before we need to go. So I want to just say thank you to everyone. And by the way, too, thank you to the 4 folks who worked with me. I think, I'm just a delight to be working with you. And thank you so much to our audience. And please, you have our contact information. We are definitely there for you. If you would like to reach out to us and get more information and resources, please, please, please feel free to do so. Thank you very much, and have a good remaining part of the program. Thank you.
Thank you, guys.
Bye-bye.
Bye, everybody. Thank
Bye,
you.
everyone. Thank you so
Please
much.
fill out the survey.
Survey. 5 stars. Shalom says we got 5 stars. Thank you.
Oh my God. There we go.
We'll take the 5 stars. I love it.
Yep. I'd be happy with 4. I mean, or whatever. 5, that's so
No,
nice.
Gordon, we're getting the 5 stars.
Yeah.
Okay, I'm fine. We're getting the 5 stars. That's
No, exactly. I'm just happy I can breathe now. After right before you started, Gordon, I took a drink of water and it went down the wrong pipe, and I just.
Oh, yes. I heard you. I said, "Oh my God, poor guy."
I was like, even when I was reading, I read the first couple things and I realized I'm having a hard time breathing right now because until it goes down.
Bye, Fiona. Bye. Thank you so much. We appreciate
you.
Thank you.
Yeah.
Thank you.
Those things happen. I mean, what can you say? I've had a similar sort of experiences sometimes in my teaching when I was a teacher, where and there you go. Yep.
I want to ask, how was it, Rebecca? You were with us from the beginning to end.
It was excellent. Gordon, would you mind hitting stop record, and then we can debrief a little bit if you'd like?
I'm not sure how to do that. Stop video.
Okay.
Stop it there.
I think,
I got it.
okay, you got it?
Yeah. Yep.